Okay, hello, my name is Bo Calder. I'm a Maryville University Family Nurse Practitioner student. Today I will be performing my physical examination demonstration. I have my model Star with me, who has graciously agreed to participate in this exercise. Prior to the examination, Star emptied her bladder and placed a hospital gown on. I noticed Star, her appearance, her demeanor, her mood, her behavior, everything seemed very appropriate. She appears to be in good spirits. Her gait was steady. And we're going to go ahead and begin the physical part of the examination. I'm going to start by just letting you know again that we're going to be doing some inspection, observation, palpation, which is touching, and I'm going to use some of the equipment that you see here. Please let me know if anything is uncomfortable or you have any questions. We also obtained a complete set of vital signs, including height and weight, and everything was normal. And we checked cranial nerve 2, acuity, and vision is 20/20 corrected. And Star, I'm going to begin by looking at your head, your hair. Everything appears to be normal cephalic. Skin color looks good. You have some nice warm undertones. Hair is well groomed. No odors. I'm going to go ahead and look through it. Not seeing any parasites. I don't see any lumps, bumps, or bruises. I'm going to go ahead and palpate. Let me know if there's any tenderness. Feel okay? Mm-hmm. Okay, and again, no lumps, bumps, or bruises noted. Okay, so the overall face, again, color looks good. I don't see any nevi, any moles, any scratches, any abrasions. Skin color looks, again, very good. Eyebrows are symmetrical, even hair distribution, eyelashes, nice eyelashes. They appear to be dense. Nose is midline. Lips are nice and pink. Very nice. So I'm going to do some palpation, some touching. So just let me know if you feel any tenderness. So the bones in the face appear normal. And I'm going to palpate the frontal and maxillary sinuses. Let me know any pressure there. No. No pressure. Good. And go ahead and open your jaw and close your jaw. And one more time. And very good. And close your jaw. That was the temporomandibular joint. I didn't notice any clicking, ease of movement, and there was no discomfort with that. Yeah. Okay, very good. We're going to go ahead and start with the eyes. The sclera appears nice and white. There's no drainage. I'm going to look at the conjunctivae, nice and pink. If you just look up a little bit, nice and pink. And I'm going to press around your eyes here for the lacrimal apparatus. Any discomfort there? No. Okay, very good. That's normal. Star, let's go ahead and check your near vision. And so if you'll just close maybe your left eye, we'll begin there. So this is about 14 inches away from your face. What line can you read easily?
The bottom.
Okay, go ahead and read it.
4, 2, 8, 7, 3, 9.
Very good. And go ahead and close the right eye. And let's try this one more time.
4, 2, 8, 7, 3, 9.
Very good. So with the Rosenbaum, we have 20/20 corrected vision. Very good. Let's just take a look at your eyes there. I'm going to just focus in on my nose, and I'm going to check for pupillary response. And your pupils are about 2 to 3 millimeters in diameter, and I'm going to check for they react to light. I'm going to check direct and consensual response. So if you just continue to look at my nose, direct response, consensual, direct response, and consensual. And again, that's good. Pupils are equal round, reactive to light. we're going to now take a look into the eyes. Okay, Star, if you'll just look straight ahead, maybe at that fixed object there, and I'm going to see the red reflex. I'm going to go up into the eye, and very good. I can see the optic disc, and superior temporal, inferior temporal, superior, I'm sorry, that was nasal, and very good. And we're going to do the same thing on the other side. And we have a red reflex. I'm going to go into the eye, and superior nasal, inferior nasal, and superior temporal. Very good, very good. You're okay there?
Yeah.
Okay. So we're going to try one more test. We're going to do the cover test. So I'm just going to ask you to, again, if you'll just look at that clock on the wall, and we're going to cover one eye and remove it. Very good. And we're going to cover the other eye and remove it. Very good. No strabismus, which is normal. That's good. And now let's go ahead and just follow my finger without moving your head, okay? Just follow my finger. And very good. Okay, last test that we're going to do with the eyes is confrontation test. So if you'll just cover your left eye, I'll cover my eye, and just tell me when you see my fingers come into view.
No. 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 No.
Very good. And let's uncover the other one. Cover the other one.
No. 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 No.
Okay, very good. So that was cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducen. So the eyes are fine. We're going to move on to the nose. The nose is midline. Any tenderness there? Okay. And can you occlude one nostril for me and breathe in and breathe out? And let's do it to the other one. Any problems there?
Just, no.
No? Everything's good? Okay, good. I'm going to look up your nose, if you don't mind. If you just look up, and I can see you've got nice pink, moist tissue. Turbinates are present, nice and pink. There's no drainage. Nasal septum is midline. Very good. And if we were testing smell, that would be cranial nerve 1, olfactory. We typically don't do it in a normal exam unless something was picked up problematic through the history. So now we're going to go ahead and move on to the ears. If we go ahead and palpate the ears. Any tenderness there? No tenderness? Okay, I don't feel any lumps, bumps, or bruises. So we're going to go ahead and, okay, and we can see the tympanic membrane. It's nice pearly gray. There's no inflammation. Ear canal is clear. I really don't see any cerumen. No redness and no drainage. And we'll go ahead and do the same on the other ear. And again, the ear canal looks clear, scant hair. Tympanic membrane is pearly gray. I can see the reflective light, and sparse hair. Any problems with your hearing?
No.
No. Okay, very good. I'm going to stand behind you, and if you could just cover maybe the right ear, and I'm going to whisper a word to you, and you just tell me what you hear. Baseball.
Baseball.
Very good. And if you can cover the left ear. Tennis ball.
Tennis ball.
Very good. Okay, one more with the hearing. Now, I'm going to use this tuning fork, and I'm going to place it on the top of your head. And I want you to tell me if you can hear the vibration of the sound in both ears equally, or more so in one or the other if it's absent, okay?
Both ears.
In both ears? Okay, very good. We're going to do it again. This time I'm going to place it on your mastoid process. And again, tell me when you do not hear it, and then I'm going to place it next to your ear and tell me then when you do not hear it, okay?
Okay. Yeah.
Very good. And air conduction was twice as long as the bone conduction, and we would do the same for the other ear. So you're hearing, that is cranial nerve 8, the acoustic or the vestibular cochlear nerve, and so your hearing is good, no problems there. We're going to go on and move to your mouth, and we're going to start with the lips, nice and pink. You don't appear to be dehydrated, nice and pink and supple. If you could just go ahead and open up. I'm going to take a good inspection. The hard and soft palate, nice and pink. The uvula, this midline, anterior, posterior pillars, feel nice and pink. This tongue is nice and supple. Can you raise your tongue for me and put it to each side and to the other side? Very good. I'm going to use my tongue blade to really get in there and look. Looks like you have all of your teeth and nice and white. I don't see the cavities or any dental caries. Again, if you'll just open up your mouth, and if you could just say "ah" for me, and a little gag reflex. Very good. That was assessing cranial nerves 9 and 10, the hypoglossal and the vagus nerve. Everything appears to be normal. We're going to see. I'm going to do a couple more exams on the face. We did palpate the face, and there was no tenderness noted there. Can you puff out your cheeks for me? Very good. And big smile, show me your teeth. Very good. And big smile without your teeth. Very good. And squint your eyes down and wrinkle your forehead. Very good, very good. Everything appears to be normal. That's cranial nerve 7, which is the facial nerve. And what we're going to do now is, I just want you to close your eyes and tell me if you feel the sensation.
Right cheek.
Okay, very good.
Left cheek. Chin.
Very good. And that was cranial nerve 5, which is the trigeminal nerve, occipital, maxillary mandibular nerve. Go ahead and just close your eyes again. We're going to just let me know that you.
Right hand, arm, left arm, right leg, left leg.
Very good. And now let me know if it is sharp or dull, okay?
Soft. Sharp.
Very good.
Soft. Sharp. Sharp. Soft. Sharp. Sharp.
Very good, very good. You're doing great, Star. At this time, we're going to now move down to the neck. The neck is symmetrical. I don't see any lumps, bumps, or bruises. Trachea is midline. I'm going to stand behind you and assess your thyroid. And if you'll just take the thyroid and Star, if you'll just swallow for me. Very good. We can feel the thyroid moving up and down with ease. And we're going to check carotid pulse and carotid pulse. Very good. And I'm going to listen with my stethoscope. So if you could just take a little bit of a deep breath and hold it. Go ahead and breathe out. And take another one and hold it. Very good. So I do not hear any bruise, which is good. Everything appears normal. I'm going to do a little bit of palpation, checking some of the lymph nodes. We're going to do pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, the superficial and clavicle chain, the supraclavicle and the infraclavicle, and we don't notice anything there. Very good. So we've done the head, the eyes, the ears, the nose, the mouth, the throat. Let's go ahead and I'm going to do an inspection of your back. And I'm just going to take a good look here. And Star, again, the skin looks nice and clear. There's a few freckles. I don't see any nevi or any moles that would be of concern. I'm going to do a little percussion or tapping. Very good. And Star, I'm going to put my hands on you, and what I'd like you to do is just take a deep breath for me. Very good. And just one more time. Very good. And I can see that the chest is expanding equally. I'm going to go ahead now, Star, and we're going to, let me just move the camera a little bit here so we can see. We're going to do diaphragmatic excursion. At this time, Star, I just want you to take a couple breaths and then take a deep breath and just hold it for me. Just let me know when you're ready. Very good. Okay, I'm going to mark it right there. Exhale. Very good. And just take a couple regular breaths. And now exhale all the air out and hold it. Okay, so I'm going to mark this area. It's about 4 centimeters for diaphragmatic excursion, which is normal. So you're good there. And we would do the same thing on the other side as well to assess the borders of the diaphragm as Star breathes in and out. Star, I'm going to go back here again, and what I want to do is when I place my hands on your back, if you'll just say the number 99.
99, 99, 99, 99.
Very good. And Star, I'm going to go ahead and listen to the posterior aspect of your chest. So just breathe normal for me. And very good. Lung sounds are clear. Respiration is a normal depth. And I didn't hear any advantageous sounds. So that's really good. Star, before we do the anterior, I'm going to just ask you to shrug your shoulders for me. Very good. And just one more time, shrug your shoulders. Very good. And that was cranial nerve 11, and that's the accessory. And if you'll put your head to your left or to your right, hyperextend back and forward. Very good. And now if you can go against my hand, very good. And this way, very good. And backwards, very good. And forward, very good. And again, that was assessing cranial nerve 11, the accessory nerve. Okay, I'm going to take a look at the anterior part of your chest. So I'm just going to lower your gown a little bit if you don't mind. Okay, let's go ahead and right? Okay, so we're taking a look at the anterior aspect of the chest. Again, a few freckles. I don't see any moles or any nevi or any bruising or lumps or any bumps. Can you take a deep breath for me? Very good. The chest seems to expand symmetrically, which is good. I'm going to again do some tapping and just to listen to the resonant sound. Okay, so if you're just and we're going to do it here on the side. We can get you. You can just take your arm out and you can hold that and just. Very good, and we'll do the same thing over here. Very good, just put your arm back there. Very good, and now I'm going to take a good listen. And again, just breathe normal for me. Here on the side. Very good, and over here as well. Very good. Okay, we'll go ahead and put your arms back in there. And again, Star, as I am assessing the anterior, I'm noting if there's any heaves or thrills. Which I do not note any. But again, I'd like you to, when I touch, if you'll just say the number 99.
99. 99.
Very good.
99.
Very good. Again, no heaves or thrills noted, no pulsations. Very good. So let's put your gown back up. While I've got you, though, I'm going to take a look at the back. And if you can just lean forward a little bit, and I notice that the spine is midline. I'm going to palpate any tenderness there. Any tenderness, Star?
No.
And so the cervical spine is, or the entire spine is midline. There's no curvature, no kyphosis. You can sit back up, or scoliosis or lordosis noted. Okay, the next thing I'm going to have you do is we're going to lay back so I can assess the abdomen. So Star, I'm going to just go ahead and get comfortable. Okay, are you comfortable, Star?
Yes.
Okay, very good. And I'm going to go ahead and look at your abdomen. And we need a blanket for you, so we can, we'll take your gown down and put it this way so we can see if you don't mind.
No.
If you don't mind, you're okay with that? Okay, very good, very good. Okay, so I'm going to look at the abdomen, and again, I'm inspecting the skin of the abdomen. I don't see any lumps, bumps, or bruises. So I'm going to now listen to your vowel sounds. Okay, vowel sounds are active. I can hear them nice and gurgly. So I'm going to do a little bit of light palpation. So again, just let me know if you feel any tenderness.
No.
No tenderness. Good. No discomfort.
No.
Okay, very good. I'm going to do a little deeper palpation. Again, just let me know if you feel anything that is uncomfortable.
No.
No. Okay. I'm going to step on the other side here. And I'm now going to do some tapping again, and for its normal timpani sound, drum-like sound, I'm going to do a little deeper palpation to identify your borders of your liver and spleen. First, let me let's find that liver. Okay, right here. And now, Star, again, I'm going to go from resonance, noting the liver border span about 5 or 6 centimeters, which is normal. And on the left side here, I'm going to the splenic border. There we go. A dull sound. Very good. And I'm going to do some palpation here. This is a little deep. I'm going to just raise up. And what I want you to do, Star, is just take a deep breath and exhale. Okay, and we can just feel the border of the liver. Just one more time for me, Star. Okay, and exhale. Very good. We're going to do this for the kidneys as well. So again, if you'll just inhale for me and exhale. Okay, that's the right kidney. I'm not palpating it. Don't feel it, which is normal. Okay, we're going to do the same thing with the left kidney. So take a deep breath for me and exhale it. Okay, and again, I'm not able to detect it, which would be normal. I'm going to take my stethoscope now and listen to some of the blood flow here. We're going to listen for the aortic, the renal, so right renal, left iliac, right iliac, femoral, and femoral. Okay, very good, very good. I think we've covered everything on the abdomen. So at this time, Star, if you'd like to sit back up, that should be fine. We'll put your gown back on. And go ahead and I'll help you sit back up. Very good. Okay, so at this time, Star, I'm going to really take a look at your extremities. So just looking at the extremities, comparing one to the other. Temperature is nice and warm. The skin is nice and soft. Muscle mass is equal. We're going to check some pulses. In fact, I need to actually go back to your chest to listen to, I don't think I identified the heart sounds. So, aortic, pulmonic, herbs, tricuspid, and the mitral valve, or apex of the heart. And I hear S1, S2 left up, nice and even and strong. So now I'm going to go back to the arms, and let's see, we're going to look at the arms, just relax them. Fingernails, see that you have the acrylic nails. We're going to check capillary refill. It's nice and brisk. Capillary refill, nice and brisk. Star, can you squeeze my fingers? Strength is nice and equal. We're going to check a brachial pulse. Just relax your arm there. Check the brachial pulse and the radial pulse and the radial pulse and the brachial pulse. And I think we're good there. Again, no lumps, bumps. We have a few freckles there. Very good. Now, let's see. I'm going to check a couple reflexes. So we'll start with this arm here. Just relax your arm out. And sorry. Just relax your arm out. Very good. There we go. And radial as well. Very good. And very good. Very good. Okay. Star, now we're just going to take a look at your lower extremities. Again, muscle mass seems equal. The skin color looks good. Temperature is nice and warm. We're going to check the popliteal pulse. Just relax your arm there. Popliteal pulse. Popliteal pulse. Dorsalis pedis pulse. Dorsalis pedis pulse. Posterior tibialis. Posterior tibialis pulse. Very good. Okay, so I think we have checked all of our pulses. We checked all of our reflexes. Go ahead and just stand up one more time for me, Star. I don't think we're running out of time. We're right at 31 minutes. Again, if you'll just kind of lean forward like you were touching your toes. Again, looking at the spine, it's nice midline. No tenderness there.
No.
Go ahead and stand up, Star. No kyphosis. There's a nice curvature to the spine. And I think that completes our physical exam. I want to thank you, Star. And that completes it. Thank you.